Wednesday morning. We're joined now by Dr. Hong.
Yeah, this morning we're here to talk to you about a very serious issue, ovarian cancer, because more than 22,000 American women are diagnosed every year, and many of that results in death.
16,000 deaths a year, which outweighs the cervical cancer and uterine cancer combined together.
Wow.
And I hate talking about cancer. It's so depressing because, I mean, it's the fear that all of us have, you know, is dying of cancer, and especially ovarian cancer, because there really aren't any classic signs or symptoms. Recently, there have been some guidelines saying if you have certain symptoms, you may want to get checked for ovarian cancer. And the reason is because if you get ovarian cancer found early, like in stage 1, the 5-year survival rate is very good. It's like 90 to 95%. But the majority of people are found in stage 3 or 4, and the 5-year survival rate for that's only 20%. So it's really an awful disease. But the problem is that our screening tools and physical exams, etc., aren't very good. So if you take a look at your screen here, the risk factors aren't classic. The majority of people with ovarian cancer don't have these risk factors, but the most important ones are being older age, having never been pregnant, having a family history. About 10 to 15% of people with ovarian cancer had a family history of it, in particular their mother or sister. And also the BRCA1 or BRCA2 gene, that is the breast cancer gene that is associated with having both breasts with breast cancer as well as both ovaries. There's a 40% lifetime risk of ovarian cancer if you have this gene. So for the screening that you can say if it's screening is getting a blood test called the CA-125, as well as getting a transvaginal ultrasound. Now if you combine the two together, only 5% of the time are you going to be able to find stage 1 ovarian cancer. So that's really low. I mean, the whole point is to try to catch it when it's stage 1 or very soon, but it doesn't do a very good job of that. And in the general public, 80 to 90% of the time, it's wrong. Only 10% of the time is correct. So if you do have both of these tests as a routine screen and you ask for that, you have an 80 to 90% chance that's going to be wrong, and that's going to lead you to surgery. The symptoms that are classically known, so to speak, but they aren't classic, are having pelvic pains, bloating, increased abdominal girth, and urinary urgency and frequency, which often imitates irritable bowel syndrome, having the bloating and then having the vague pain. And as far as the belly growing, some people just feel like they're fat, but that's, this is different. It's because fluid actually goes into the abdomen cavity, and that can happen. So anyway, I'm hoping that they're going to be able to find better screening tests here, but at the time, it's not so good.
Basic rule of thumb for, is it older women that should get screened, or?
The high screen women should be with a very strong family history of ovarian cancer, or if you have breast cancer.
Okay.
All right, Dr. Hong, thank you so much. Time now, 6:51. We'll turn things over.